To identify a pelvic imbalance, we need to determine if there are two main types of misalignment in the pelvis. The first is lateral displacement, which means a sideways shift. This occurs when part of the hip or pubic bone moves either outward or inward across the transverse plane. It may also rotate to one side or the other. The second type is rotational misalignment, where the iliac bones rotate relative to the sacral bones. This rotation can either be anterior or posterior. Now, both types of misalignment are accompanied by changes in muscle tone, which continuously supports. If there's a persistent imbalance, it indicates an imbalance in the muscles that maintain the incorrect position of the pelvic bones. Let's start by addressing the lateral shift. In this situation, two muscles play a role in stabilizing the pelvis. First, the oblique muscles of the abdomen. These muscles affect how the pelvis shifts at an angle to the side. During this movement, two specific muscle groups are involved. The first is the internal and external oblique muscles of the abdomen. The second is the gluteus medius muscle. The gluteus medius stabilizes the pelvis from below, while the oblique abdominal muscles provide support from above. For example, if the gluteus medius stops functioning properly, the oblique abdominal muscles will automatically shorten, causing the pelvis to shift inward. Conversely, if the oblique abdominal muscles stop working and the quadratus lumborum compensates by shortening, the pelvis will rotate outward. So, how do we correct this? A visual inspection alone isn't sufficient. We use muscle testing to assess the imbalance. Specifically, we test the gluteus medius and the oblique abdominal muscles. Let's start with the oblique abdominal muscles. Have a seat. With a straight back, we position the patient like this and ask them to press with their shoulder. Press. Press again. On this side, the oblique muscle is functioning well. On the other side, the oblique muscle is weak. We've identified an imbalance in the oblique muscles. The muscle on this side is weak, but it's functioning properly on the other side. Now let's check for any dysfunction in the gluteus medius muscle. To do this, we test the gluteus medius. Let's do it correctly. Lie on your side on the left. Raise your leg upward. The gluteus medius has 3 portions. We'll begin by testing the middle portion. Press toward the floor. There's no muscle tone. Press upward. It's weak. From the earlier test, we saw that the oblique abdominal muscle seemed fine, but the gluteus medius on this side is weak. We can already conclude that the pelvic alignment is not normal here. If the gluteus medius is weaker, the oblique abdominal muscle will shorten. This much is clear, right? To confirm, you can double check. Sit down. But during treatment, this step isn't necessary if the imbalance is evident. It's clear that stretching is required, but for scientific curiosity, let's explore how to determine if the muscle is shortened. First, let's do a quick stretch. No, hold yourself steady with your hands when needed. Yes, like that. Now stretch, stretch, stretch. Turn, press. Good. If the muscle is shortened, a quick stretch of about 4 to 5 seconds will cause it to lose tone. Hold, press. The tone doesn't recover well. If you stretch it for 3 to 4 seconds, it will still weaken. But this shouldn't be done during treatment. Minimal testing is generally ideal. You can often rely on visual observation, right? Can you assess it just by looking? No, sometimes you have to test. Sometimes testing is necessary. But not always. Testing doesn't need to be done frequently. In this case, it's clear the muscle is shortened. So why do additional testing? It's unnecessary and wastes time. Now turn to the other side. Here, we can see the gluteus muscle is shifted inward like this. The oblique abdominal muscle on this side is too short, while the gluteus muscle is too weak. What do we need to do here? We need to strengthen the gluteus medius and reduce the shortening of the oblique abdominal muscles. Now let's check the other side. On this side, the oblique abdominal muscles are weak, correct? Let's test the gluteus medius. Raise your leg. The gluteus medius also isn't functioning properly. So, neither the muscles supporting the pelvis from below, nor the one stabilizing it from the side is working. It often causes pain here. When you moved it suddenly, it hurt, didn't it? Yes, when I yanked it, it shifted. See, you didn't stabilize it during the exercise. Okay, let's go through everything now and demonstrate the proper exercise. Yes. So, what needs to be done in this case? First, we need to relieve the tension in these muscles. Press upward. We can even test the muscle portions individually. The front portion works well when pressed upward. The middle portion, however, shows significant weakness. For the front portion, hold your leg in this position. It's very challenging to hold, even in this simple position. Now the back portion. Yes or yes, the back portion is strong. In fact, it's so strong I could almost hang my weight on it. But the front portion, which should be powerful like steel, has become noticeably weak and thin. It needs isolated strengthening. First, activate this muscle and address the trigger points to allow it to contract effectively. You can use the method of stretching combined with resistance. From this position, you can remove the trigger point. But if the patient feels uncomfortable or self-conscious in this position, it's important to consider their comfort. Focus on the attachment points.